4212. That's 407-422-1212 or text 23680.
Shut something off here that's still on. Yay! Hey, welcome to the show. Like the echo?
Little reverb, never heard any.
All right, boys, back at the studio here. Let's see if I can fix this myself. Welcome to Stages of Life Radio. How are ya? Nick's Finest says, no. I can't do it myself. I really can't. I'm trying, but I don't think I can do it.
This is where we find out whether the engineers are asleep in the broom closet.
They are. All right. Hi, guys.
There we are.
Well, not really. I don't know that we're sending that out. But anyway, it's an awful lot of fun listening to it. Hey, everybody. How you doing? Hope you are hearing us right now. We are Stages of Life Radio, 407-422-1212. Give us a call or text 23680. Again, 23680. So I saw the Hot Flash Tactical Response Team in my driveway, and I knew immediately that Dr. David Klein was here to give me relief from my hot flashes.
Or it's indicative of the fact that you're having one. Here we come. Lights are flashing. Yeah, that's one of our emergency vehicles, the Hot Flash Tactical Response Unit, which is my pickup truck, of course. So what we're going to do, at least as we're doing it here from our remote studio, and hopefully we'll be back in the main studios either next week or the week following.
Yeah.
So we won't have quite as many technical challenges because we're sitting out here remotely, trying to do all of the functions that we would normally have a team of professionals behind us, or at least one person. So we're going to talk about hot flashes. What's it all about? Who gets them? Why they get them? When they get them? And what to do if you do get them? What your options might be. So the first thing is what's a hot flash? And you think you might know. All right. So it means different things to different people. It's a symptom, not a disease. So some individuals, some women, some men will get this. And so it may end up being an experience of hot sensation at night. Can't sleep, can't do this, can't do that. You might be perspiring. You might find yourself just getting overheated or feeling as though you're getting overheated. So what are the sorts of things that can cause this symptom? What disease states? But even more interestingly, what organ systems can become dysfunctional that will result in your complaint of hot flashes? Well, the one you're going to come to first, if this were a multiple choice question, you'd get this one right, and that would be ovaries. What you wouldn't necessarily get right is that the adrenal glands, these are these clear bits of tissue on top of each one of your kidneys. You can get hot flashes from that. And it may, in fact, be the most common cause or common location of disorders that will cause and give you or somebody else hot flashes. Thyroid, this butterfly-shaped gland that's in your neck, can cause hot flashes. So thyroid dysfunction can be responsible. Pituitary dysfunction, little tiny gland in your head, it's not really the master gland, although if this were a multiple choice question, you'd want to answer it that way because that's what most people think about the pituitary. It's really little more than a servo mechanism. And the pancreas. These are the most common places, common organ systems that will cause symptoms that either are hot flash in nature or are, in fact, these bits and pieces of hormonal imbalance. So what is it? It's a reflection. It is a symptom of hormone imbalance. Not any particular hormone. There's a list of them. Why does this happen? Well, first, who gets hot flashes? And you're going to go, well, it's women. And I'd say that's mostly true. Not entirely true. Talk to somebody who's undergoing therapy for, let's say, prostate cancer. They will talk to you about hot flashes. The hot flashes that these men get make many of the ones that women get look and pale by comparison. When they start going through chemotherapy, it's very much like somebody cutting the bottom out of your bucket. So it's not always women. In my practice, that's basically who comes through the front door. You have hot flashes, I'm going to be looking at a biological female. Now, why? It's not necessarily hormone imbalance due to age. It could be somebody as young as 20, 15, 18. they can get hot flashes. You may make it all the way up into your 90s and never have a hot flash. But what I will tell you is it doesn't necessarily mean that you don't have a hormone imbalance. It's just simply one of the manifestations of these imbalances. So is a hot flash a dangerous thing to get? And the answer is no, unless you happen to be collateral damage. One of the women gets a hot flash or a series of hot flashes, and you could be caught in the crossfire.
See, that's how I posted the show on the social media.
Oh,
I was like, men and women, people who get affected by and suffer because of.
Yeah. Well,
and trust me, everybody around you, and we even sync up as women. I've given another woman a hot flash just by being there.
TMI.
It's crazy.
Yeah.
No, it's not TMI. That is not TMI.
I get it.
John.
No, just busting. So, but hormone imbalances are very, very interesting. But men can actually not only suffer from women's hot flashes. Okay, when they get them, you had better duck and cover. It's something that all men learn in shop class in middle school. So as you get older, it becomes more likely that you're going to get this. So when can you expect hot flashes? When do you think they're likely to occur? And again, it could be as young as 25. It happens not infrequently in the practice. We may see 2, maybe 3 women of that age per week with hot flashes. They tend to be a little bit more challenging, but not impossible. But the age of 40 is where it really starts to kick in earnest. So why does this really matter? Okay, why? Because life is not to be suffered. So what do you want to do? What's first and foremost on your to-do list? First thing you want to do is to find out why they're occurring. That seems pretty straightforward, doesn't it? You go to the gynecologist, you say you're having problems with hot flashes, and what they often do is hand you an estradiol pill and say, this ought to take care of it, without really knowing what's causing it. That is not a particularly effective or safe intervention. What if the hot flash is coming because you have too much estradiol? You think that giving you a tab or a suppository is going to help you? And the answer is no. So what can cause the hot flash? Imbalance. Imbalance can happen in multiple ways. So I want you to imagine for a second that you're looking at a chandelier. And the chandelier has 10 candles in it, 10 lamps in it, 10 lights. So what makes a chandelier look nice is balance. It's the fact that all the lights are lit to the same brightness, to the same color. And that's a key concept there. So, light bulbs have different temperatures, measured in Kelvin. This is how white hot the sun is supposed to be before it gives you a particular color of light. So it could be 3,200 Kelvin, could be 2,600 Kelvin, could be 1,800 Kelvin, and it gives you a different color. So when you put together a chandelier or any constellation of lights, you better make darn sure that they're all of the same nature. Otherwise, it's going to look like a carnival in your living room. Now, you might live in a carnival, so I am not going to necessarily diminish your choice.
No judging.
However, my wife, the interior designer, would probably find fault with it. So
the colors are great.
So
there
you go. So each of these hormones can be represented as one of those lamps. So your thyroid needs to be right, and you have 2 different thyroid hormones that are salient here. You have about 150 different adrenal hormones. You end up with 3 gonadotropins: estriol, estradiol, and progesterone, testosterone. It's 4 really. And then you're looking at cortisol, insulin, as well as pituitary hormones to see where you are. And once you figure out which bulbs are out, dim, or too bright, you can then figure out what the imbalance is all about. So the first mission is to figure out what is wrong. And this is not a trivial matter. There are people out there that think that the best way to do this is trial and error. Doctor, I disagree with you. There are people out there, at best, listen up, because there's one easy answer to this, and we're going to go over it in a second.
Ooh, an easy answer.
Easy.
Wow. 23680. That's our text line if you want to get the doctor's questions in. The questions in for the doctor, so we can try to answer them, yes. But of course, Hot Flash Tactical Response Team. That's what we're talking about right now. And you can also call in at 407-422-1212. Check out stagesoflifemedicalinstitute.com for more information on anything that we talk about today. get started.
Very cool.
All right. So, hey guys, you got a couple of questions on the text line,
Yeah,
but
you know what I'm going to do?
That's on air.
Okay,
Go
there's
ahead.
there's a really good call or text coming in wanting to know if the thyroid is corrected, will that fix high cholesterol? I'm going to go over that, but I'll go over it quickly. So yeah, just hang tight. That's one of the things we're going to discuss.
Okay. That's on.
The
This
one with
is
the itchy
radio,
eyes
this
we'll
is
deal with.
internet.
Okay, let's see.
There's nothing on the internet.
And nothing on the
or
internet
the
side?
social yet.
No
But I
problem.
got a lot of people in there listening that want to talk about your hot flashes and.
Well, yeah. What I would
Hey,
suggest
can you check and see and make sure it sounds all right? Okay, thanks. Bye bye.
is give me about 8 minutes to make it through the last little bit of what I
got
want to go over, and then we're going to start taking calls and start addressing individual answers. Just giving people individual answers. Yeah, because if I get pulled off topic on this, I'm not going to finish
Yep,
it. It's a
that's how it is.
complicated one today.
It is, but we'll probably revisit it again in a Thursday or two.
There's no question.
No question about that. Linda said that she would love to be in here in the show. She's like, "You're talking about hot flashes. Let me come in." I was like, "No,
the
we're
head
not
behind the curtain?
We don't want to hear about suffering. We want to hear about stopping the
There
suffering."
we go.
Okay, thank you. Thank you. All right, yes. Okay, so a minute and a half. Right. Got a bunch of people listening, but they're all shy. Let me see. if I can
Shy?
turn this on.
What's to be shy about?
I don't know.
If you send us your question, we will answer them. So in any event, what is the deal with hormone balance? So a couple things we're going to go over briefly. Okay, at least at this hour, and then we're going to go over the stuff again on our Thursday show. Is how do you evaluate? What do you look at? Where do you go to measure it? That's a key one here. And what does it cost to diagnose it, and what does it cost to fix it? Because all of those things are important. Nothing is worse than having a problem and not having the financial wherewithal to correct it. So it's sometimes best to remain, on the sidelines. To say, something I know I've got a problem, but I'm going to wait until I can either not buy the bass boat, and start investing in myself or whatever, or however it goes. Because none of this stuff is that terribly expensive, nor is it all that difficult, actually. If somebody like me can figure this out, I think that there's probably at least 3 other docs around that can.
At least? Oh, okay.
You would hope so.
All right, 20 seconds till we rejoin the radio.
Yes, ma'am.
Share if you care, please. Lots of people are watching. A lot of them, actually. Hey.
This will be a very informative segment.
Hi,
coming
Bogo
up.
Pet. Hello, Sabrina, Bob, Barb, Karen, Linda. Good to have you along with us. Welcome back to Stages of Life Radio Live, Sunday afternoons 4 until 5 p.m. with Dr. David Klein. I am Melissa Fox from Good Morning Orlando, weekday morning, 6 to 9. And right now we are talking about hot flashes, and they affect everybody.
Thank you.
Everybody. So, Dr. Dave wants to get through a little bit more here about this one, and you left me hanging. You really did.
Good. If I left you hanging, it means I left about 100,000
Do you remember where you
hanging.
left me hanging, though?
Not sure.
Oh, dang it. You were going to have the answer to what helps out the hot flash.
Yes. Well, what are the symptoms of having a hormone imbalance? So we've got a text message saying, fixing the thyroid correct cholesterol elevation, and the answer is actually that's one of the many things that happens when you have a hormone imbalance. So what hormones go out of whack? If you go to the gynecologist, you're going to look principally at estradiol. They're not going to pay much attention to testosterone. They may look at progesterone, they may not, but they don't do thyroid. Oh no, we don't do thyroid. You have to go to an endocrinologist for that. The endocrinologist doesn't do the gonadotropins. Nobody really likes doing cortisol. And when you're dealing with, so you're at odds with yourself. You can't find somebody that's going to handle the whole picture, because if you don't, none of this works. So if you go to your stereo, it used to be called a stereo, now they're called sound systems.
Hi-fi?
Hi-fi before that. So you ended up with these things called equalizers. So the really better ones, either had bolt-on equalizers or you had these slide jobs, so you could adjust the gain or the volume relative to others, is what that's called, gain, within certain frequencies. So you could adjust within a particular series of the certain frequency, mid-range, high range, low range, or the better ones you could break it down into 5 or 6 or 7 different ranges. That's the way it is with hormones. So if thyroid goes out of whack relative to estradiol, progesterone, testosterone, cortisol, and insulin, it has one set of symptoms that you'll usually see. If estradiol drops, but progesterone remains the same, you may never have a hot flash, and yet you're at serious risk of developing osteoporosis, dementia, and heart disease. So the silent problems are every bit as important as the ones that you can see from across the room. Somebody sweating bullets, may actually have a problem that's less serious than the one that doesn't. So what are the symptoms of, let's say, gynecological hormone imbalance? So it could be anything from being, angry, miserable, depressed, hot flash, dry down below, saggy skin, saggy other things, all kinds of problems, or there may be no symptoms whatsoever that you can understand or relate to. So if you're celibate, you may never even notice that the intimate issues that you're having are now no longer pleasurable or even possible without pain. So there are many, many different symptoms here, and some of them are pretty personal. So when you ask your doctor's going to go in there, they had best be willing to ask you about, let's say, issues of intimacy, issues of comfort, issues of energy, libido is a type of energy. So what are the symptoms? They are varied. Everything from nothing but feeling just not yourself to feeling like you want to rip somebody's head off and defecate down their neck. So there are many different ways that this can go down. So what do we do? So what I'm going to approach here first before I get into specific enzyme or hormone systems, if you need this type of help, Stages of Life, this is my specialty, and we're happy and here to deal with this. There's it's just my mission, has been for about 40 years, is looking at causes for misery, causes for pain, causes for depression. So you're depressed, are you? Well, here's an antidepressant. Well, that's kind of weird, isn't it? Do you think your body has a chemical shortage of Paxil? Do you think really you have a shortage of lithium? You might actually. There are these medications that are really not found in nature. It's highly unlikely that your body has developed a spontaneous mutation that requires that particular chemical. So something is missing. It's either going to be a hormone or it's going to be a neurotransmitter. And these hormone systems regulate all of it. So you have to find out why this is going on. So you can reach us at Stages of Life Medical Institute at 407-679-3337, which is the way most people reach us. They try the telephone. Why? Because most of our patients are a little bit older. They might feel a little bit more comfortable using the telephone. If it's a flip phone, you know that you're out of touch. So what we do is we can go ahead and see you in the office. You come in, we take care of you. These days, though, people are getting more and more used to not showing up at the doctor's office for health care. Okay, fine. Begrudgingly, and I do mean begrudgingly, we're willing to do this. So we can do new patient, and I don't call them new patient evaluations because really without a physical examination and a really thorough, we're talking 1 to 2 hours worth of work. To me, it's not really an evaluation, but it's a data gathering effort in order to find out what lab work needs to be done. So you contact us by phone or stagesoflifemedicalinstitute.com and hit the Contact Us New Patient tab. Get us the information and we will call you or text you back and let you know what we need to do. So then you go ahead, we do that by telehealth, but I want the lab work done in my office for a number of reasons that I don't have the time to get into right here, but it has to do with precision, accuracy. Those are two different things, as well as rapidity and completeness. So 2 weeks following that, we can either follow it with another telehealth visit, or the best thing you can do is make that your first in-person visit. Now, we service almost 1 million people, as our catch area. So odds are you are in that area and we're within 35 to 45 minutes of your home. So it's really not that much trouble to come in for your health. So what can you expect this thing to cost? This always comes up, and so I'm going to get it right up front, as opposed to many of the other people in there, which they will not tell you what it's going to cost. We're going to give you all kinds of financial advice. We're going to do all these other odds and ends, but we're not going to tell you really what it's going to cost you.
Don't bury the
until
lead.
until the end of the game. So don't bury the lead. It's exactly right. Well, I'm going to bury it right now. And so the survey visit, you call up, and what we do is we run through the appropriate questions to find out what lab work to order. That's going to take us time after the call. is $149. That's to get the process started and to make it legal. We have to have diagnosis codes in order to send the laboratory out. Otherwise, you can go to any lab test now and do it, and it'll cost you about $3,500 because the insurance companies won't cover it. So we have to do this in order to get the laboratory work to be coverable if it is covered. So the laboratory work is going to be somewhere between $200 and $495. If you pay for it yourself, again, at the big box stores, it's $800 to $3,500. So it's costing about 25% of what it would be outside. So it's a bargain at that. When you come in to see the doc, either me or one of my PAs, most people will see the PAs first, then they turn them over to me because there's a lot of paperwork that has to be done, and they do it faster than I do it. Medicare covers it all. Medicare covers all of the labs. TRICARE covers all but a very, very small amount. Companies like Cigna, United Healthcare, Aetna, Blue Cross are unpredictable. And we already know that. Anytime that you ever use your Blue Cross to see about getting something done, it's sometimes surprising what they do and don't cover, especially medications and laboratories. So the telehealth visits that are follow-up are $130 a pop. And that's where we do the management. So what about, the medication? What's that all about? So let's say somebody comes in and they have to get testosterone replaced. So we see one male for every 4 females. So it's 20%. Well, it's about $27 a month. That's $27 for the testosterone with chrysin and progesterone in one cream. 90 days is about $82, $84 delivered to your door. Now, I don't do that. That comes from a compounding pharmacy of my choice. Why do I do that? Because it's going to cost 1/3 of your choice. The second thing is that I know exactly what the base is going to be. So I don't give people a tremendous amount of leeway on that. So for $82 to $85 in that range, every 90 days, that's about the typical patient. Thyroid hormone runs about $1 a day. That's what it's going to cost you from about any of the pharmacies you go to. Adrenal replacement is extraordinarily variable. It could be nothing because most people don't need it. The nutritional stuff and vitamins are individual. That's something that we do case by case, patient by patient. Now, how do you follow this up? And this is the fun part, okay? You go ahead and you give somebody these pills. Oh, well, if you feel better, don't call me again. No, you really need to do follow-up lab work. Otherwise, you're not going to know whether it's safe or not. Yeah, the hormone levels, they work something like this. Too much of a particular hormone and you get sick. Same hormone, too little, you get sick. So what's the dosage? What's the level? Where do you want to be? And the answer is right where it's supposed to be, in particular relative to your age, disease state, vital signs, and other hormone levels. They all have to balance, kind of like an orchestra. Too loud, too soft, both bad. So a conductor not only tells you when to start and when to stop, but how loud and how proud to be with regards to your instrument. As a musician, one of the hardest things to do is to listen to a conductor tell me how to do what I'm going to do, which is why you get fired. The conductor's the one that hires and fires. So what do we do at Stages of Life? We handle what we need to handle. We do it with great skill, alacrity, and a good bit of precision.
Look at that. All right, we got Jared to take care of. We also have Joe. She's got some questions on our social media page. Check us out, Stages of Life Medical Institute, Facebook, and YouTube, and all the wonderful places where you get your social on.
What about anti-social media?
No, we don't do that. That's a negative, sir.
All right, sorry.
All right, 407-422-1212. You are listening to Stages of Life Radio on News Radio WFLA Orlando. That is a negative.
I love it.
Jared, you there? Hey, Jared.
Yes.
Yes. What's your question for the doc?
Is he still working for Subway? Or is that a different Jared?
No. Yeah, I sure am. No, my question for the doctor is, I'll give you a quick rundown. My mother just turned 97.
Congratulations.
About at Christmas time, she had 2 TIAs within the 10 days.
All right.
She's been taking bare aspirin for 500 milligrams about 4 times a day for the last 50 years. They told her that wasn't doing the job anymore, so they gave her Plavix and Lipitor. Well, she was online Googling Lipitor this weekend, and also an article in the paper, and it has memory loss and quite a few other things.
Good for your grandma.
She'd like to come off the Lipitor.
Yeah, she's right.
Come off the Lipitor.
Okay, well, here's the first thing. She's taking way too much aspirin. So if she takes the dosage that she's doing right now with a 500 4 times a day, along with Plavix, Eliquis, or any of the others, she's going to bleed out. You know, that TIA.
No, I'm sorry. She's not. The hospital took her off bare aspirin.
Oh, good.
They just put her on Plavix.
Yeah. All right. Well, I'll tell you.
Her arthritis is a lot worse now.
Yeah. So you can use any number of other anti-arthritics and get the job done. Aspirin is an old-timey anti-arthritic, and it's really not one of the better ones. The dosage of aspirin that helps with TIAs is very interesting. It's 82 milligrams a day. That's 1/4 of one tablet once a day, and best taken at bedtime. So the way that I typically treat people in that age group when this occurs is I'll put them on 82 milligrams at bedtime, and fish oil, because fish oil is an anti-inflammatory, but it's also an anticoagulant. So she would be taking between 1,500 and 3,000 milligrams of a high-quality fish oil, not the garbage that you can get at the discount stores typically, because you want the right amount of EPA and DHA, and it should really, under best circumstances, be free of mercury and lead and other heavy metals. So what else do you need to do? If her cholesterol's high, and it may not be, the docs, the cardiologists, they tell everybody to go on a statin, and I believe that to be wrong. 20 years from now, that's going to be considered, in my opinion, to be a disaster. So what do you want to do to lower the cholesterol if it's a little bit elevated? High-dose folic acid. Dosage is 5,000 micrograms daily. It's cheap as dirt at our Stages of Life Institute. I think it's $4 a month. Doesn't get too much better than that. But if her cholesterol does need to be lowered, you use bergamot, bergamot, N-acetylcysteine, NAC, and then stick that with the folic acid, and that should obviate, that means eliminate the need for the statins.
Okay, the hospital put her on Tylenol.
Fine.
Take that like 4 times a day, 500 milligrams.
That'll work. But we're going to be cutting back to the radio here momentarily, Jared.
Hi guys, welcome back to the radio show. We're just taking calls and hanging out on the internet during the radio break. It never ends. Is what it is.
Yeah, we just heard from the fellow who's denying being the Subway spokesman.
Yeah, he's not the Subway Jared. Hey, are we able to take some of the questions?
Let's go for it.
Okay.
Yeah.
Now we have Joanne. Now she's been patiently waiting on social media. She said her progesterone is very low, testosterone is very high.
Okay.
DHEA also high. Just recovered from low cortisol. Now cortisol's in balance.
Okay.
After the Cortef treatment, and I'm weaned off and fine, but the testosterone and DHEA
it all depends
are high.
It all depends on how high the testosterone is. So if you're looking at the laboratory's ranges and then deriving the H's and L's from that, you're going to make a mistake. The appropriate dosage level of testosterone should be between 50 and 80. Now, they'll say, well, it's normal up to about 24. No, actually, it's not healthy at that level. That's where you start seeing problems with osteoporosis. So you want it between 50 and 80. Your estrogen level to be normal in most age groups that are going to be calling into this show should also, oddly enough, that's estradiol should be between 50 and 80. Progesterone should be 1 and 2. The problem with a low progesterone is it doesn't balance the estrogen. If your DHEA is between 100 and 225 as a female, it's appropriate. It's right where you want it. They call DHEA the fountain of youth hormone. They do it for a reason. So DHEA does in fact convert into progesterone and testosterone. So if DHEA is in fact high relative to the progesterone and testosterone, more than likely you have a mineral deficiency causing it. This is where it gets to be fun. Figure out the cause. That is going to be the key to this business. You still have to take the Cortef because otherwise nothing is going to work. It's priming the pump. So, you may be taking as little as 20 milligrams of Cortef a day, as high as 80 or more, but you want to see a cortisol level between 10 and 20. Right. 10 and 15 really is good enough, but what you want is a mineral replacement. And I would be using something, if you use our product, that's great, and if you don't, that's okay too.
Just do it.
Go to stagesoflifevitamins.com and look up Magic Minerals and see what's in it. And if you can get those minerals in those dosages, you're good to go. What that will do is it will reflect very easily on the way your adrenals are able to produce. Now, what is a vitamin and what's a mineral in this context? They're called enzyme cofactors. So you have an enzyme that is not working properly for whatever reason, and more times than not, it is not going to be something along the lines of a genetic difficulty, not at your age. Otherwise, you would have already had it when you were younger, but it's going to be nutritional in nature. So why did I start with minerals? Because it's the most likely possibility, but could it also be vitamin? And the answer is yes. So you can take a B vitamin with it, but the mineral is where you need to focus. Which ones? Manganese, magnesium, zinc, selenium, vanadium, chromium. Just look at magic minerals. Take it or take something similar. You know, if you'd rather do it with the B vitamins, we have one called Down to Basics, but you'd have to take additional minerals with it, because that's just the way I prefer to do it. But that's probably where your problem is. It's probably going to be a mineral deficiency. Magnesium, most likely.
Thanks. Joe said, yeah, she just had a bowel resection and sepsis. So.
Yeah, and so she's not absorbing.
Yeah.
So, you know, how do you fix this? Okay, well, first thing you want to do, if you had sepsis, the implications are that they put you on antibiotics, lots of them, usually 2 or 3 intravenously, and they made your gut just as clean as it could possibly be. You need to restore the gastrointestinal flora, and there's going to be a multiplicity of things that she's going to have to do. First thing is to take a very strong probiotic. Again, go to my website and look for the 100 billion, that's 100 billion CFU probiotic, and you take that for a month. You follow that with, there's one in there which is called a spore probiotic, and you leave her on there for about 6 months. While you're doing this, and this is going to go on for a while, you have to take a prebiotic. And the one that I like is very, very expensive, very, very hard to get. You go to Publix, you might go to Winn-Dixie, and it's called Del Monte brand zucchini squash in a can. And then you take a tablespoon or 2 simultaneously with the probiotic. This feeds and allows the bacteria to hide as it gets absorbed and enters your gastrointestinal tract. A can of this stuff costs $1.37. You get a big can for $2, and it'll last you about 2 to 3 weeks. That's how you start with this, but you'd better take the higher dose of the minerals and the vitamin B, or the B complex, at least to get you through this. And it shouldn't be that hard to fix.
Go. All right, now earlier off air on the social media only, we answered the question about the thyroid being corrected, high cholesterol returning to normal.
Yes.
Did you say it would?
It most
should.
frequently, should is a better word. You know, things don't always follow the way you expect them to.
Okay.
But one of the principal ways of diagnosing hypothyroidism is high cholesterol. If you're taking a statin, it throws this out. You can't really judge what's going on. But if you walk in fresh, you're not on a statin, you're not on something that lowers cholesterol, and you've got a cholesterol of 230, 240, 280, something that's over 200, your temperature is below 98, you have hypothyroidism in spite of what your lab work looks like. So back in the day before we had TSHs, which, by the way, doctors don't even necessarily know how to read,
Right.
okay, you would see and make the diagnosis of hypothyroidism based on high cholesterol. That was how it was done. So these are things that you need to do as part of your lab work in order to follow through with what you're doing. So if you're going to be doing saliva testing, good luck. For starters, it doesn't work. It's a joke. Second thing is you can't check the rest of anything with these saliva tests. The only thing it's any good for is to find out whether you have salivary amylase. And I've had one patient in 42 years that had a difficulty with salivary amylase. Go figure.
Okay, Doc, we got a question from Kathy back listening on the iHeart app or on social media. She says, do you think the COVID vaccines are safe now or they're going to cause long-term? She had the Moderna, the first shot, got a panic attack.
Okay, this is not going to help you with your panic attack.
And she's due for the second one April 3rd, but she's afraid,
she
doesn't
needs
know if she's going to get it.
Okay, now, if you're going to get a panic attack, okay, you need to figure out what it's going to take to prevent that. So it could be a little bit of sublingual Xanax, or it could be a little bit of just meditating, whatever it takes. The shot didn't cause the panic attack, promise.
No, she knows that.
Okay, now when I was in the military, we used to line up 1,000 people for mobilization. Okay, and so you'd be doing shots on one side. I was a hospital commander, so you have shots on one side, shots on the other, and these GIs, they used to call them, were going down the line. And about every 30th one would pass out or do something stupid.
Because of the needle.
Yeah, the needle. Yeah, right. Okay, yeah, the needle. Yeah, they go, they turn pale and go down. And they weren't the wimpy guys that usually went down. It was usually the beefy ones, the ones that go out there and I'm going to eat Wheaties and nails and drag burning tires along or whatever it is that they do.
Like bricks.
I'm going to look like I'm really macho. And then you give them a shot and boom, down they go. And so the only good thing about it was most of my technicians, most of my airmen. They were airmen when I was in the Air Force. They were corpsmen when I was in the Navy. I did both. Okay, we're women. Okay, so you have these diminutive gals, and they'd be going down the line getting theirs, and they do just fine, and you end up with these big football players or ex-footballers or whatever, and they would go down like a bag of rocks. So get it. Okay, I got the Moderna. My wife got the Pfizer. What it typically does is it may cause a little bit of achiness in your arm, which is a good sign, not a bad sign. The evening there after that, you may feel a little bit punk or puny or call it what you want. You just don't feel right. My wife felt a little feverish, but she ached a little bit. I ached a little bit after the second one. I woke up at 6:15 in the morning. I thought, wow, I just don't feel right. I stood up to get my coffee, and by the time I made it to the coffee machine, it was gone. Get it. The symptoms of COVID are awful. Getting the disease stinks. It's not nearly as much as fun as they say it is. I had COVID. My wife had COVID. She still can't taste or smell things. She burned a pot, place filled with smoke, and she couldn't smell it. She can't smell bad garbage. This is dangerous.
There's good garbage.
Very, very dangerous when you can't smell or detect food that's gone bad. All right. So
dangerous.
This is not a joke.
Yeah,
so
just
get
do
it.
it, Kathy.
Just do it. Be patriotic about it. Roll up your arm.
Right.
Get the shot. Step outside, then have your panic attack.
Let's call it Trump's vaccine.
Call it Trump's
If
vaccine.
that
You'll
makes
be
you
fine.
happy, call it Trump's vaccine. Jam in your arm. I got
If
the
it makes you
Moderna.
unhappy, then call it Biden's vaccine. It doesn't
Whatever,
matter what you
man.
can call
Whatever
it Seymour.
happy's here.
You can call it whatever you want. Just get it.
Look, I got it on the first one, Moderna,
Yeah.
on this Tuesday. Now, I've been a little sleepy and logy, but that also may have been with the time change, too.
You think?
A little
Or the
bit.
fact that you get up at 2:30 in the morning or 3 o'clock to get on the air?
Yeah, that might be part of it,
Yeah,
too.
never. Who knows?
Anyway, hey, can you suggest something for severely red, swollen, itchy, allergy eyes? Eye drops aren't working.
Yeah. Okay. First thing you want to do, and this is going to sound stupid, but
Wash
it does
your
help.
hands.
Wash your hands. Don't touch your
How did
eyes.
I know that?
Does that work? And the answer is yes. And it's also helpful with regards to COVID. Second thing is not going to be so obvious, and it's called KY jelly, or you can use Vaseline. You take a dab of it and run the inside of your nose with it, just on the outside. And what that will do is it will catch the pollen before it gets into your nose. That's extraordinarily beneficial for a bunch of folks with allergies.
And you can also eat locally sourced honey.
Yes,
to
it does
build
help,
up,
actually.
To build up a tolerance to the allergens in the air.
Yeah, which, by the way, I swept up 2 inches of oak pollen over
man,
the weekend.
you ain't
2
kidding.
inches.
It was ridiculous.
Okay? Insane.
And the weather's still kind of sketchy out
Iffy.
there.
Yeah, and then don't go anywhere, because I've got a couple other things I'd like you to do after these important announcements.
All right, so there you have it. 407-422-1212 if you want to get on the line for the last segment of the Stages of Life radio show. Or you can text your information and questions in at 23680. Only you can prevent forest fires.
Smokey the Bear. I bet he's going to be dissed also, don't you think?
You think?
Well, he'd almost have to be, because it's diminutive to other bears or other species of forest creatures. You know?
I don't know. That's a jury is out on that one.
Yeah, Smokey the Bear. That's probably why they took him off the air years ago. That or union issues.
It could have been union issues.
Yeah, I'm still trying to figure out the teachers' unions up in Massachusetts and Illinois. So they don't want to go back because they're getting very used to the fact they're being paid to do nothing or very little. That's the ultimate. Now, I'm not a union guy. You may find this to be the case. But, for forever, it's been, pay me to do less and less and less. So when I worked in D.C., lived in D.C. area, on the streets, when people were doing work on the street, there'd be 5 people in one pothole, 1 with a shovel and 4 people working, 1 to document it, 1 shop steward, 1 safety officer, and I think the other guy was just in case the first fellow had to take a cigarette break.
Right.
And there'd be 5 people to fill up 1 hole. And that was always a big joke. It isn't a joke. Okay, so what's the best job of all? It's one that you get paid not to go to.
All right, Kathy still wants to know if there'll be any long-term side effects from the vaccine.
Nope. There's no reason why there would be. The Moderna and Pfizer are called mRNA vaccines. And so what they do is they go in the tissue, which is a strand of mRNA surrounded by something that's a little bit like chicken broth. It's a lipid. Gets eaten by a cell called a macrophage. The macrophage then incorporates the mRNA. It starts to develop these things that look like zits, these little bumps, which then trigger an immune response. So other macrophages come in and eat them, and then all of a sudden you start developing this immune response. So it will ache because of the inflammation around the shot. That is a good thing. It's exactly what you want. So there really isn't going to be any downstream to this. So coronavirus is one of many viruses that cause the common cold. When you get the common cold, you get a teaspoonful, a lot of mRNA, and just plain RNA from the virus.
Oh.
It goes in and replicates trillions of times. If that ever made or turned you into anybody other than yourself, that would be when it would do it. Not just getting this most minuscule amount of mRNA,
Sure.
which, by the way, cannot change your DNA, never will. Long term, it'll keep you from dying.
Oh, hey, yeah, there's that.
Yeah, I forgot about that part. The 600,000 people that are going to die.
Positive side.
600,000. It's a lot of dead people that wish they could have gotten your vaccine.
Yeah, it's true. Just do it.
Get it.
I mean, really.
But we really value our listeners, and we would like to keep you breathing if it's all the same.
It's all theater.
Yes.
Welcome back. Oh, Stages of Life Radio, 4 to 5 p.m. Sunday afternoons live. Dr. David Klein also joins me every other week on Connections, Relationship Radio with a Twist, Thursday nights at 9 o'clock here on News Radio WFLA Orlando. I am Melissa Fox, and if you want more information on Dr. Klein or anything he's been talking about today, go to stagesoflifemedicalinstitute.com. And if you'd like to be a new patient, You want to be patient. You want to be a patient. Click on Contact Us and the new patient information and all that goodies there, right?
And then we'll give you everything you need to have to come through, or at least to make a decision whether you want to or not. So we're there Monday through Thursday from 8 until about 4:30, 5 o'clock.
Yeah.
And we have people that actually just drop in to see if we are who we say we are.
Are you?
And we're happy to do that. If you
Joe,
come in, I want to shake your hand. That's fine.
You know, in the last segment earlier, you mentioned the zucchini squash.
Zucchini
Does it have
squash.
to be Del Monte?
I happen to like Del Monte. Okay, the reason I did that is because I haven't checked out any others. And the reason, okay, is that it tastes good. Okay,
Wouldn't fresh zucchini be better?
no, not necessarily, unless you're going to sit back and make it yourself with the appropriate amount of onions and tomatoes.
Okay, so therein lies the goodies.
Yeah, there's more to it than just the zucchini squash. So I know it's in the Del Monte canned variety. What you make at your kitchen, I can't address that. It's just not going to happen. So why Del Monte? Because you can't beat it for $1.39,
Okay.
honestly.
And fresh is not better making
No,
fresh
not in this
squash
case.
because you can't control the ingredients.
Exactly. More so is that if you don't have the right tomatoes, the right amount of tomatoes, onions, and whatnot.
So booyah.
So I just
It's the what now?
I happen to know that it works. I don't know whether yours does.
All right, so there you have it.
So for $1, just go for it.
Just do it.
Yeah. How can it be so hard?
407-422-1212. Got a little bit of time left if you want to get on the line there. We've been talking about the Hot Flash Tactical Response Team, which is basically a truck you've seen riding around here in Central Florida.
Well, it started off as a joke, but
it really wasn't.
It really wasn't. It's
No,
my truck.
I follow that truck all the time.
Yeah, really. Yeah, I drive that truck on a daily basis to and from work. So it is me. If you see Stage of Life Tactical Response Unit, it's a white Toyota Tundra.
Hot Flash.
Wave at me, okay? Because that's who I am. I'm driving it. Now, once in a great while, somebody borrows my truck. So if it's somebody that's really, really good looking, it's probably not me.
Oh,
So
fair enough.
Fair. I was wondering if I was going to go with that.
I wasn't sure.
Yeah. So
Okay,
go
so
on.
we were talking about the hot flashes. Give us the quick recap about what it can be, how it can be dealt with, and
The trick to this is you want to know exactly what it is.
Okay.
That's most important. Second thing is women are changeable, just like the weather. So you have to keep an eye on them. It's not enough to get one set of lab work and expect it to change
We're
because
a living
women
being.
do not change. Men,
no, women change.
oh man, okay. Men don't. So it could be ovarian in nature. By the time of 50 years of age, they're largely gone. So why is it? And where do you get your estrogen, progesterone, and testosterone after the ovaries are gone? The adrenals. So it could be ovarian or adrenal. Thyroid adjusts
No, that
all
was me.
and everything.
That was me.
So-
When I started getting the night sweats, I mean, I'm talking like 2-3 times of changing clothes, sheets, laying
Yeah.
on towels, just to get it through the
Hypothyroidism.
night. It was the thyroid. People were like, hot flashes already? And I'd already been in menopause for a while, so it could have been, but it wasn't.
It wasn't.
It was the
You didn't
thyroid.
have problems with that. It was your thyroid. in order of likelihood. And then pituitary issues, you can end up with people with prolactin secreting tumors. So we do, in fact, screen for that. And then pancreatic issues. If you're hyperinsulinemic, then the other hormones have a tendency not to work as effectively. So who gets it? Mostly women, but not always. Age of 40 is most typical. Now, if you don't have hot flashes, does that mean that you don't have a problem? And the answer is absolutely not. You probably have the worst of all issues. Because if you don't get this right, cholesterol, heart disease, dementia, those are the things that you're probably going to get. But you're going to get osteoporosis. So do I think the answer is Fosamax or Boniva or one of the bisphonates? The answer is no, unless you want your teeth to fall out and have fractures of the spine and hips, in spite of the fact that they are giving you something. So what are we going to do? First and foremost is blood work, not salivary testing, not kinesiology, hold this thing and I'm going to push down on your arm and find out if it's right for you. That's not for me or for thee. It's blood work. And it's very, very specific, and it's done in constellations because you need to look at estrogen and progesterone, testosterone together. You need to look at DHEA and cortisol together. You need to look at DHEA, pregnenolone, and cholesterol if you're looking at things like dementia. So these things have to be looked at in the appropriate groups, and they need to be done by somebody that really knows what the heck they're doing and not the do-it-yourself, gee, are these H's and L's? Highs and lows, highs and lows. No, it's ratio games here. It's all about ratios. So what have we got there? Oh, what's my wife's interior design information? You need one. She's excellent, okay? She talks a lot. Okay, but it's called Winter, W-Y-N-T-E-R, Interiors, and she's now telling me that she
doesn't talk that much.
She doesn't talk on the air. So if you need one, call send a text into Melissa, and she will give you her contact information. It's called Winter Interiors. She is excellent, even if she is my wife. Which, by the way, is how I've met her. Okay, so just so you know that sometimes you find good contractors and you want to keep them. That's what I had to do. I'm going to get beaten for that one later on.
Okay, I think I spelled that right. There we go.
Did you get it for him?
Okay.
Excellent.
There we go. Yeah, well, wow. Look at that answer. Then I'll get a question marks back. What? Who is this?
Yeah. No, she does fine. She's really magnificent at the work she does. She's taking my home, which was the ultimate bachelor pad for 10 years.
Man
pad. Okay, and is now turning into her she cave.
It's just kind of funny as I'm getting a little
funny.
The liquor leftovers. I've got a box of leftover porn. Can you store this here, please?
Yeah, hey, I gotta get this out of my house. You know, so it's interesting. So I'm starting to accept the inevitable, which is yes, dear, no, dear, anything you say, dear.
About a minute left here, so let's go ahead and recap your all the goodies.
In any event, if you need to reach me, or reach my office, reach my team, which is really what it is, we have a team of 20, one doctor. Okay, and 19 other people attached to it. Wow. So we can be reached at 407-679-3337. Ask for Iris. She will take care of you. We can be reached at stagesoflifemedicalinstitute.com, and then you look for the Contact Us New Patient tab, and then we will get back with you. You can come in and visit us at 1917 Booth Circle. That's in Longwood, Florida. It's a piano throws off of I-4 at 434. It's a beautiful facility. We're there Monday through Thursday, and you can come in and just say hello, look us over, and see if there's a right fit. Yeah. So it's a primary care office. I've got 5 board certifications. I do pretty much what I choose to do on a daily basis, enjoying life and enjoying the practice of medicine.
Should, right?
Yes, indeed. I love it. Look, I live for it.
All right, that's Dr. David Klein, and we will be back again next Sunday at 4 o'clock. I will be back tomorrow morning at 6 a.m., bright and early.
Well, as they say in Hawaii, mahalo.
Yeah, that's what they say. Thanks for listening, guys. We'll do it again next week.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts most insurance and Medicare, too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.
joy, happy, happy, joy, joy, happy, happy, joy, joy, happy, happy, joy, joy. Hello, boys and girls. This is your old pal, Stinky Whistle Seats, and this is a song about a whale.